The most serious risk for taking opioid medications is the risk for overdose. If you take more than your body can handle for whatever reason, it can depress the breathing centers of the brain and you could actually stop breathing. What would put you at more risk for an unintentional overdose would be starting a new opiate medication or switching to a newer, especially a long-acting version. Other conditions might be certain medical conditions like chronic lung disease or kidney problems or liver problems. Particularly with long-acting opiates like methadone or OxyContin, increasing pills even by one pill can put you at increased risk for overdose. Other substances can combine with the opiates to make you more at risk of an overdose as well. If you take certain medications, especially like Valium or Ativan, they work together with the opiates to make you more at risk for an overdose. Alcohol or recreational drugs, even at low levels of use, taken along with opiates can increase your risk for overdose death.
You want to check their breathing, and if you see that their breathing is down to possibly 10 breaths a minute, that loud snore, that gasp for a breath, and then there's those seconds in between before when another breath is taken. The lips are blue, the face has gone gray and ashen color. You can't wake them up, and they're becoming unresponsive. There's different ways to get someone's attention if they might not be breathing. You're going to shout their name, you're going to move them, and if that's not working and it's not waking them up, then you may take your knuckles and begin to rub on the sternum like this to get some response. Now, if you've done this and they're still not waking up, you need to know what to do next. You want to prop their head back, make sure that everything is clear within their mouth and nose area, and clamp the nose, and you just put your mouth over their mouth and take 2 or 3 breaths into their body. Just blow in. 2 to 3 breaths in. You call 911 and you simply have to say, somebody in my home has stopped breathing. You've done the rescue breathing and they're still not responding, and you're saying, I need to do something more. You're going to go after your naloxone.
Naloxone is a very safe medication. It's been used by paramedics in the medical system for many years. If this is not an opiate overdose, you're not going to hurt the person by giving them naloxone.
Naloxone works on the opiates. It does not work on, again, the benzodiazepines. Valium that you've probably heard about, Xanax, Klonopin, and Ativan. You're going to grab a hold of your kit, put in the plunger, screw on the nasal adapter, insert this in the nose, give it a half a spray in the right nostril, put it in the left nostril, give it the rest of the dose, and then give them some immediate rescue breathing on top of that. In your kit, there are 2 vials of naloxone. There's one, of course, you're using initially, and if you find out after about 2 or 3 minutes that it has not had any effect, you want to administer that second one to make sure that there's enough naloxone to stop the effect of the opiate.
The rescue position is on one side, usually the left side, with the left arm above the head. This helps them to breathe more clearly. This is the position that you want to keep the person until EMS arrives.
You want to make sure you stay with the individual. So the naloxone might wake them up, but the naloxone eventually is going to wear off, And again, that narcotic prescription then could kick in.
Even if you give the naloxone and the person who has overdosed becomes conscious, it's still important to get EMS to the scene as soon as possible. The opiate that had been in their system relieving their pain is no longer working, therefore they might have pain, they could have some symptoms of opiate withdrawal, and they may be very uncomfortable. Your body adjusts to opioid medications and develops a tolerance. Over time, taking these medications, you need more of a medication to achieve the same pain relief result. It's very important that if for some reason you're off of your pain medication for a period of time, like you're in the hospital or you're ill and can't eat or drink very much, that you not go back to your previous level of use. As that tolerance has gone down, your body will be more sensitive to the medication and you'll be more at risk for an overdose. About 1 in 10 people might have a problem with addiction with opiates. And it's not a problem that should scare you from getting adequate pain relief with the right medications. Signs that you might be experiencing symptoms of addiction are taking more of the medication than was prescribed, taking the medication for pains other than what it was prescribed for, or other reasons than pain. Some people might notice that they take it when they're emotionally distressed or if they can't sleep. Some people even get a buzzed feeling or a happy feeling from taking the medication. A clear sign that there might be a problem with addiction is that there's a loss of control around the medication and taking the medication. If you notice any of these signs in yourself or in a loved one, it's important to get in contact with a physician.